Okay. Sige, let's continue with the antimetabolites class. Since they are analogs of the different compounds involved in RNA and DNA synthesis, thus automatic then that their work is in the interference or in inhibition of the DNA and the RNA synthesis also. So instead, I hope you can still remember paano nagte-take place yung ating DNA synthesis. Let me write on the screen. Diba, for example, for DNA synthesis, didi ko kabili mo draw. Yung kabili mo draw double helix. For example, like that, diba, kailangan mag-unwind muna yan sila. And then, yung mga bases na tinatawag natin, pag naging double strand na yan sila, ika-copy. Okay? So, naatay mga ginatawag og nitrogenous base. So, ang structure sa ato ang DNA, we have here the backbone na sugar, phosphate na nag-alternate. Sa kabila, phosphate, sugar. Pero ang nasa gitna nito, yung mga tinatawag nating nitrogenous bases. And what are those? We have the pyrimidine and the purine. Purine na bases natin. Diba, meron tayong mnemonics for this. We have here, pyrimidine is picat. Picat means C is cytosine, U is uracil, and then P is thymine. And then for purine, ang ginagamit natin na mnemonics is purga, purine for guanine and adenine. Okay, yun yung ating mga nitrogenous bases na nasa gitna. Okay, nagpa-partner-partner yan sila. And sila yung tinatawag nating codons, tatlo kabuok na pasunod, whether pyrimidine man na siya or purine, basta tatlo kabuok codons atong tawag ana. For example, you have the cytosine and then the guanine and the adenine. Tatlo sila kabuok codons na sila. And then another 3 here. Depende na kung ano ang nakalagay. For example, like that, codons. And then ito yung nire-replicate natin, class. Nagre-replicate tayo for this, for the DNA replication. And then we also have the so-called RNA transcription. So, meron ding si RNA sa kanya. Now, ang mga antimetabolites, ang trabaho nila, since their structures are similar to these compounds, either cytosine, uracil, thymine, or pwede po guanine and adenine. Pareha sila, almost pareha silang structure, ana. Mahimo silang murag false nitrogenous bases, wherein papalitan nila, kung we have a codon like this one, papalitan nila yung mga parts ng codon na nandyan, for either the DNA or the RNA synthesis. And that will lead to, almost of the time, arrest of the DNA or RNA replication. Or again nga, synthesis. Pag walang DNA synthesis, there is no division of the cell, and thus for the case of cancer, hindi na sila dadami. Okay? Yan yung trabaho ng ating antimetabolites. Therefore, since their action is in the DNA or RNA synthesis, meaning cell cycle specific sila, which is nasa S phase. Yung DNA and RNA synthesis, nagte-take place yan sila sa S phase, which is a part of the interphase. So, without the DNA and RNA synthesis, dili na maka-move on sa mitosis ang cell. And then there will be arrest. Hindi na siya mag-divide. Yan yung trabaho ng ating anti-metabolites. Okay? And then, I still have time. Group lang ang tawag niyan, ha. I mean, group of anti-cancer drugs, we call them anti-metabolites. Now, what are these anti-metabolites? Number 1, we have the so-called antifolate agents. Again, we call them antifolate agents, and from the name itself, folate, anti-folate, meaning they will inhibit the formation of the folate or the folic acid in the body, which is a vitamin, specifically vitamin B9, and ang trabaho niyan is for the cell division. Again, the folic acid is for the cell division. Now, since anti-folic acid sila, then magkakaroon din ng arrest in the cell division if walang folic acid. Now, what are the specific drugs under the anti-folate agents? We have the Methotrexate, Pemetrexed, and Pralatrexate. So sa Methotrexate, ang mechanism of action nito, since sabi ko kanina, anti-metabolites are derived from the normal compounds found in our body, therefore methotrexate is derived and related to the structure of folic acid. Again, ang iyahang structure is related to folic acid. Thus, magkakaroon siya ng interference in the work of the folic acid. Ano ang ginagawa niya? Methotrexate inhibits mammalian dihydrofolate reductase. This is an enzyme, the DHFR. And this enzyme is actually responsible in the conversion of folic acid to tetrahydrofolic acid or FH4, which is the active enzyme na supposedly magkakaroon ng activity for cell division. So, para mas maintindihan ang mechanism of action ni methotrexate, so we have here, ito yung normal na pathway natin for folic acid. So, di ba, for example, ang mga buntis, ginapatake na sila og folic acid para po sa development sa baby, para mag-assist sa cell division, sa cell growth, sa fetus, for example. Pero, dili lang ang baby ang ginahanglan pati kita. So, unsay trabaho ni folic acid? Pag makasulod na siya inside the cell, it will be metabolized by the enzyme called dihydrofolate reductase na mahimo siya og FH2. We call this FH2. But another enzyme, the same enzyme, the dihydrofolate reductase will convert the FH2 to FH4. So si FH4 ngayon ang naay responsibility for cell division. But if a person takes methotrexate, and si methotrexate can also enter the cell, ang trabaho niya is to inhibit the dihydrofolate reductase so that this folic acid will not be converted into FH4. So si folic acid kasi hindi siya magkakaroon ng work unless maging FH4 siya. So since si methotrexate is similar to the structure of folic acid, masaag ang dihydrofolate reductase class. Instead na mag-take siya action on the folate or the folic acid, diri na siya mag-take og action kay methotrexate. So na-inhibit ang formation of the FH4, which is the active coenzyme for the cell division. Okay? So itong actually itong FH2, even without the dihydrofolate reductase, magkakaroon siya ng action pero it's more on the DUMP and the DPMP, though later na natin yan siya i-discuss kasi iba ang action nito. May ibang drug na nagtitake ng action into this part here na DUMP and DPMP. Now, si FH4 actually, kapag ma-metabolize na siya, babalik siya into FH2. Pero ang problema natin if wala talagang dihydrofolate reductase, FH2 will not be converted back into FH4. So walang folic acid and ma-disrupt yung ating cell division. Now, for the pharmacokinetics of our methotrexate, we have different routes of administration for this. It can be given orally, intramuscular, even intravenous, and then we also have intrathecal routes for our MTX. This is abbreviated as MTX, ha? Now, inside the body, methotrexate will be metabolized to polyglutamate derivatives. However, high doses of this drug will undergo hydroxylation at the 7th position and ibang metabolite yung kanyang ifo-form. We call it 7-hydroxy. This is hydroxy. 7-hydroxy methotrexate. Now, what is our problem with methotrexate? Methotrexate is not soluble in water. And therefore, magstay siya sa kidneys, or it can be incorporated in the urine but in the form of crystals. So this can cause the adverse drug reaction or the adverse effect called crystalluria. You will have crystals in the urine and that is very painful. Remember, may mga solid materials na mag-pass through from your bladder to your urethra, padulong sa pag-ihi mo na yung mga solid substances. So, painful na siya. Okay? Now, what will happen to, what should we do para ma-avoid natin ang formation of crystalluria from the methotrexate? The patient should be given enough hydration. Dapat magsigig inom og tubig ang patient ani to avoid the renal toxicity of our methotrexate. So sa urine man jud gud na siya niya muagi kay ang route of elimination of the MTX is via the urine. We can even see the metabolites class of MTX in the urine. So that is a board exam question ha kanang paimnon nimo permig tubig ang imuhang patient na naga methotrexate. Now, asa na to ginahatag atong methotrexate? This is usually given in combination with other drugs to the following types of cancer. We have here acute lymphocytic leukemia, the Burkitt lymphoma in children, breast cancer, bladder cancer, and even head and neck carcinomas. So muna tanan ang pwede gamitan for our methotrexate. Pero board exam question, aside from being an anti-cancer drug, methotrexate is also used for autoimmune diseases such as severe psoriasis. We even give methotrexate for rheumatoid arthritis and Crohn's disease. Crohn's disease is an autoimmune disorder. It can be an autoimmune disorder gihapon, pero the problem is on the bowel movement. So it's more on the gastrointestinal tract wherein there will be changes in the bowel movement of the patient. So bakit siya ginagamit for autoimmune diseases? Kasi remember, its action is on the cell division and not just with the somatic cells in the body, yung mga cells natin sa body, included dyan yung pag-arrest ng cell division ng mga immune cells natin. Example, mga lymphocytes, mga white blood cells, okay? Mga neutrophils, basophils, ma-inhibit niya rin yung cell division yan. And since our problem with autoimmune diseases are very active ang kanilang immune system, isuppress natin. So si methotrexate has immunosuppressing action, and that will explain its use for those na na-mention na autoimmune disorders. Okay? Questions for methotrexate so far? Wala. So adverse effects, itong nausea, vomiting, and diarrhea, this one is common. Even the stomatitis, the rashes, and even the alopecia. But syempre, since it can suppress also the immune cells in the body, so it can cause myelosuppression. At high doses, myelosuppression is suppression of the bone marrow that produces the red blood cells and even the white blood cells. Now at high doses class, again, this is not really a water-soluble drug, so it can damage the kidneys. And to prevent that, kailangan hydrated pirmi ang patient. So kailangan tagaan og daghan water supply. Okay, and then aside from that, we can have neurologic toxicities for this drug. Pwede siya mag-cause og mga different types of neurologic nerves na mga toxicities. Kasi remember, folic acid ang iyahang gina-inhibit, which is also needed for our nerves to function. And this is also a board exam question. Last na ito. Tomorrow we will continue with Methotrexate. Leucovorin is our antidote for methotrexate toxicity. Other name for leucovorin is folinic acid. So, pag nasobraan si patient ng methotrexate, ang antidote natin, leucovorin. So, please take note of that name. So, for the meantime, dito sa tamag-end, sa tamag-end class kay it's 10:27. So I will be giving you a copy of the recordings for you to review and katong mga nangawala karon kay nag-brown out. We will continue tomorrow. Take note na ang quiz is update lang ko kung kanus